Hi, and welcome to this episode of the Medicaid Moment videos where we talk about long-term care Medicaid planning for older and disabled adults. I'm Catherine Jacobs, estate planning and elder law attorney with Warner, Norcross, and Judd, and today we're going to talk about the patient pay amount. What is the patient pay amount? So this is specific to when someone is residing in a skilled nursing facility. When you are residing in a skilled nursing facility and receiving long-term care Medicaid, there is a calculation for how much the patient has to pay. What is their patient pay amount? This is very easy to determine if you are a single person. So a single person's patient pay amount is their income less $60. So a very simple example of that would be if someone's income was $1,060 from Social Security, their patient pay amount would be $1,000. They would get to retain $60. That's sort of their pocket money. A lot of times they use it for haircuts. Older adults often have trouble maintaining their own toenails, and so a lot of my clients use that as their toenail money, but it's their pocket money. Now it gets a little more complicated if if the applicant is married. So if we have a Medicaid spouse and a community spouse, the spouse still living at home in the community, there is a different way that patient pay amount is determined. And we're going to go very high level on this, but essentially what happens is that Medicaid says, well, wait a second, before we say that the patient pay amount is your income less $60, let's run a formula. Let's make sure that the spouse who's still living at home is able to pay their bills. So let's use our example of Bob and Shirley. Bob's in the skilled nursing facility. And let's say that Shirley is still living at home. She may be concerned thinking, well, Bob was the bigger earner during our lifetime, and if he's in the skilled nursing facility and all of his income goes to pay the nursing home, I'm not going to be able to make ends meet. And Medicaid is aware of that. And so they say, well, wait a second, before we say that Bob has to pay his income in full to the skilled facility, they're going to run a formula that says, let's look at what Shirley's income is, let's look at what Bob's income is, then let's look at what expenses are there. And there is a formula for allowing for shelter and utilities and different things that a person is still going to have while they're living at home. And at that point in time, that calculation may say, in our example, that Bob's income all is going to come back to Shirley, or a portion of it. And so it's important as you're looking at that, and I'll give you an example. I had a call with a client just recently, and his wife had a significant health incident and was at the hospital. And while she was at the hospital, they said, you know what, she's just not safe to go home. And the client shared with me and said, I've been taking care of her for a long time now, and it probably hasn't been good for either of us. I can't provide the type of care she needs. It's taking a toll on my health. But I was so worried that because in this case that the husband was a stay-at-home husband, took care of the kids and the house, so his income was significantly less than his wife. And he was worried that if she went in the nursing home, all of her income was going to go to the skilled facility, and he was not going to be able to make ends meet. And so, not knowing that there was this whole formula that would allow him to retain, in this case when we did the calculation, all of her income, there was this sigh of relief, but yet regret. And he said, I really didn't do either one of us a favor by not doing this sooner. And so understanding that this is probably a big fear for a lot of people, that, I know that we have to use the income to help pay for the skilled facility, but not knowing that there is that formula to help that community spouse in the situation where we have married couples. If you or someone you know has questions about Medicaid, long-term care Medicaid, patient pay amounts, please give me a call. We can talk through things, help get all of your questions answered. Looking forward to seeing you at the next Medicaid Moment.